we're gonna listen to a short lecture about internal medicine and preventive health. Okay, so with that, I'm gonna introduce to you our speaker. So our speaker is, she is a Gold Associate from Talisay City, Cebu. She is a family physician. She has this first few years as a doctor, first year residency at General Santos Doctors Hospital in General Santos City Department of Family Medicine. And then for 3 years as a resident doctor at Perpetual Sucor Hospital, Cebu. That's in the Department of Surgery. And she joined community service as a volunteer physician to medical missions for the past 18 years. Grabe, ibang klase to si Doc. Okay, and that's under Commission and Service Cebu, Caritas Incorporated, Archdiocese of Cebu, Bodhisattva Foundation, I hope I pronounced that correctly, and Phil-Am Charities Incorporated. So without further ado, if you are excited, I want you to type number 1 in the chat panel. Let's all welcome our Gold Associate from Cebu, Dr. Carmen Henson.
Good morning.
Morning
Okay.
po.
We will talk first about medicine. Medicine is an art or a science of healing diseases, especially healing diseases by the administration of internal remedies. Now, we have branches in medicine, just to name a few, and a bird's eye view. We have, for example, domestic medicine, home treatment of disorders without the advice of a physician. Now we have forensic medicine or legal medicine, the application of medical knowledge to questions of law. And then another one, just to cite an example, veterinary medicine, tropical medicine, which is a medical science as applied to diseases ordinarily occurring only in hot or tropical countries. Now, talking about internal medicine, it implies a branch of medicine dealing with diseases and medical treatment of diseases and disorders of the internal structures of the human body in adults. That's why here comes now examples of some subspecialties in internal medicine, like specialty in cardiology, respiratory medicine, gastroenterology, infectious diseases, endocrinology, where diabetes falls into play. Now, that's why we heard about specialists in all that fields. So internal medicine doctors cares for adults with greater complexities. That next slide, Beth. Thank you.
All right, thank you very much, Dr. Carmen, for that explanation. So now we're going to proceed to our question and answer. The first question is, explain to us about what internal medicine is. So
Yeah,
in just a capsule form.
I have already stated that it is all about the internal structures of our body. So we have all fields of specialization depending on the body systems.
All right, thank you so much, Doc. And then next question po is number 2, is there a possibility na makatulong sa case na sacral nerve sheath tumor ang max?
Okay. Presacral, we will digest it. Presacral nerve sheath tumor. Presacral is an area, it is a space between the rectum, and that is the lowest portion of your intestine, your large intestine, and the lowest part of the spine. That's the space, the presacral area. And then nerve sheath tumor is the covering of um, the nerve, the peripheral nerve, and then it is made up of swan shells. That's why swan cells. That's why it is also called as schwannoma. Tumor is the proliferation of tissues. So it means presacral nerve sheath tumor is a benign nerve sheath tumor arising from swan cells. So the symptoms, because it impinges on other organs, the symptoms are pain, numbness, tingling, itching or burning sensation, weakness, and the mass that the person can see or feel now is the new growth. So probably on the basis of controlling inflammation, because that's the baseline here, the new growth, the basis of controlling inflammation, there might be lessening the use of our supplement that controls inflammation, lessens the pain and numbness, but probably not to the extent of removing it. And there is some hope with schwannomas. They are generally very slow growing or may even stop growing sometimes. So if one don't have any symptoms or is not a good candidate for surgery, because here the treatment of choice for this case is surgical resection. But if you are not a good candidate for surgery, the best option is sit tight, wait and see, to wait also for a regular MRI to monitor and assist tracking of the growth of the tumor, plus our supplementation, of course, basing on the supporting anti-inflammation.
Okay, thank you
Okay.
very much, Dr. Carmen. Next question, please. Our slide share. Next question. Hello, ayan. My son had been taking Max GXL for 3 months. I noticed lately that his skin allergy has worsened and he is suffering from severe cold. So ito po, Doc.
Okay.
What do you comment on this po?
Okay, basically here, you already have an existing allergy. So now, if we based on the taking of Max products causing worsening of the situation, probably you won't reach that long for 3 months of sustaining the discomfort. But to stop and observe the symptoms in the absence of the product. So with opting to use Max supplements, why not? Why not try Max One, which is designed for those with allergy, with history of allergy for support, and wait and see. With the severe cold here, we can be helped with antihistaminics when there is an allergic element present. So Max has a role here also.
Okay, thank you very much again, Doc. So I hope that answered the question number 3, no? So if you guys are still there, I want you to type number 4 for our 4th question, which is, what about lupus? Can Max help?
Okay. Lupus is also an autoimmune disease in which our immune system attacks our own tissues, causing widespread inflammation again, causing tissue damage, affecting organs, several organs like the skin, liver, brain, lungs, kidney, and the blood vessels. Now, knowing all those, because it is an inflammatory also process, uh, we have varied symptoms. The first sign here is fatigue, fever, joint pains, weight changes, sun sensitivity, and flares. So in here, genetics and environment has a role. So our product helps a lot because we have also quite a number of associates with these conditions who were being helped by our products, and they have testified how they were being helped.
All right, thank you again. Thank you so much, Doc. So before moving to number 5 question, I would just like to remind everybody that you have to take note that Max products are supplements. Therefore, they do not intend to prevent, cure, or treat any disease. So these results are based from personal experience after taking the products. May we request not to record the following or for the privacy of the individuals and prevent misuse of the information. Okay, so for number 5, if you're excited, I want you to type number 5 on the chat panel. Number 5 na po tayo. So, wow, I really like the questions as well. I'm learning so much. Okay, so the number 5 question is, what is the best way to protect myself from COVID? Ayan po, Doc.
Okay, we were told about the guidelines the World Health Organization posted, like hand washing, the use of face masks, social distancing, avoiding bigger crowds, avoiding touching our eyes, or our mouth, and our nose. Nutrition is the best. Nutrition is a must. So we are into a nutritional company. We have we have amazing products that will help us support our immune system and boost our immune system. So there is you can never go wrong on boosting our immune system.
Okay, thank you, Doctor. So we are now down to our 3 more questions for Dr. Carmen. And if you're excited for the 6th one, I want you to type number 6 on the chat panel. And that is how to treat common colds and flu at home.
So common colds and flu are caused by viruses. They are the smallest, most remarkable of the infectious agents, being they are highly transmissible because they mutate during reproduction. So again, the causes inflammation, acute inflammation of the upper respiratory tract, like you will be having rhinitis, pharyngitis, and laryngitis. So best treatment here is prophylaxis. We interrupt the lines of transmission. How? Self-quarantine, the wearing of masks again, and increasing the resistance of our immune system again. We have max products again around to help us out. Routine antimicrobials are contraindicated. Antihistaminics are not recommended unless there is an allergic element present.
Okay,
Did
thank
I
you,
answer
Doc.
my question?
Yeah, thank you so much, Doc. Thank you so much. So for number 7, type number 7 on the chat panel, please. And that is, what are the symptoms when I have inflammation in my body and how to treat them? That's number 7, po, Doc.
Symptoms when I have inflammation. Okay, it depends on the areas affected or involved. If inflammation is being localized, physical condition in which part of the body becomes reddened, swollen, hot, and often painful, especially as a reaction to injury or infection. So we have acute or chronic inflammation. So chronic inflammation comes when acute inflammation becomes untreated, like injury, autoimmune disorders, long-term exposure to irritants like chemicals or polluted air. So that's it. Reddened, swollen, pain, hot sensation. That's all.
Wow, thank you very much, Dr. Carmen, for that very, good explanation. Aren't you glad, diba? Andito tayo ngayon sa Max and we're having like free consultation with our doctors, so diba? So if you're excited, type number 8 for our 8th question, and that is, what are the basic symptoms to watch out for cancer? What are the basic symptoms to watch out
Okay.
for cancer?
So
Yes, Doc.
when you talk about symptoms, it means it is subjective. It is what you feel. So for example, because we are pertaining into science, we mention sometimes signs and symptoms. So symptoms is subjective and science is objective, and you can see it with the naked eye. So the symptoms you will have in general, for the female, like abnormal periods, irregular periods, pelvic pains or cramps, changes in the bathroom habits, bloating, breast changes, chronic cough, chronic headache, difficulty in swallowing, or excessive bruising. Now, the early signs, meaning you have physical, you can see it with your naked eye. We have 5 here that we must not ignore. The first is unexplained weight loss. The losing weight for no reasons at all. So maybe this is the first sign of cancer. Next is fatigue. Not the fatigue after a long day of work, but the fatigue that doesn't become better with rest. Cancer eats you up. It is a nutrient affecting our quality of life. Next is fever. It is mostly night episodic with night sweats if you have no other signs of infection. Next is pain. The pain is caused in different ways. From a growing tumor, pushing another organ, from chemicals a cancer releases, and the metastatic spread. Next is skin changes. For example, moles. All moles are pre-cancerous lesions. So they are candidates for cancers. So when the mole has asymmetric or jagged edges, the borders are irregular, the color heightened or getting darker, and it's also fast growth. That's the signs that we have to watch.
Okay, thank you so much, Doc.
Cancer.
I hope you have taken note of that. And of course, if you're gonna go through back to this video or Zoom meeting, you can always, have this on from our official page of Max International. Now we are down to the last question. So if you are excited for the last question, because I think this also can help everybody, I want you to type number 9 on the chat panel. And that question is, what are the illnesses that can run in families? What are the illnesses that can run in families?
Okay. It means also heredofamilial diseases, which tends to occur in more than one member of the family, or runs in the family. So there are 5 most common genetic disorders, like Down syndrome or Mongolism, thalassemia, cystic fibrosis, Tay-Sachs disease, sickle cell anemia, which they are all rare. Pertaining to Down syndrome, this is more or less common. It is an abnormal chromosomal disorders associated with moderate to severe mental retardation. Aphasia is typical. A small antero-posteriorly flattened skull, short, flat, bridge nose, the short phalanges, and a widened space between the first and the second digits of the hands and feet. The others are the thalassemias and the sickle cell anemias. They are all blood disorders with bleeding tendencies. And we have here also diseases we inherit from parents, in which they are passed down from parents to children, heart diseases and diabetes. Thank you, Beth.
Okay, thank you so much. Thank you so much, Doc. So with that, can we all type thank you? Thank you really for, towards Dr. Carmen. Kasi po, alam natin na if we do, consultation to the doctors, it's not that cheap. Talagang bumabayad po tayo. But then here in Max International, we're given this wonderful privilege to ask our questions directly to this legit doctor.